No, I'm actually for the way that the Indians do it, indigenous people, and that they just take care of all their own people. Like it's like a kind of like a trust fund where when people get old, they get taken care of by the younger people, you know? And I don't know. I mean, I'm saying we should go tribal. Like I don't know about this, left wing, right wing, all that stuff. It's more just we should go tribal.
I am for a universal healthcare system because I think every person deserves the right to be healthy, but it's not too fair to people that have money to pay for healthcare because they have to spend their money on people that aren't really helping them. But I think it makes the whole world a better place if there is universal healthcare.
I like the idea of universal healthcare because with our tax dollars, like it's going to stop some kind of like redundant crime that's going on in the neighborhood. And if it's for universal healthcare, I think it's definitely like appreciative to the people who can't afford it.
I am. I think that everybody deserves to have health care, and so basically I think that the United States needs socialized health care for everybody, and then if you can afford private insurance, then go ahead and get it because it will be better and more efficient than socialized health care, but that way everybody can have it. And if everybody can't have it, then at least people age 0 to 21 need it because that's when a lot of diseases and illnesses and injuries can be like dealt with and prevented in childhood that will then later, allow people to be more functional in society in their middle to late age.
I am for universal healthcare system. It's definitely a very sensitive subject, but I believe everyone is entitled to free healthcare. I believe as a society, if we are able to take care of our own people and community, it only foster growth in other areas of the country, like as far as economics, business, jobs. Having healthcare means that people don't have to spend money on healthcare and can spend money in different places that can help their family, maybe education or even food or other goods and services that healthcare would not provide for them if they had to pay for it.
Am I for? I'm always for healthcare since I'm an exercise sports science major. I mean, I always want to improve people's health and I always want to see like improvements. But I think we can definitely do better in the United States because, I mean, some countries, they don't even have to pay for the health care and it's provided already. I forget if I don't know which country it is. I think it's like Canada or something.
Probably not so much because I think it's going to be tough to distinguish who's a citizen and who's not and who deserves it and who doesn't. I just think it's one of those things that people like to talk about, but no one's going to act on it. It's just too much work to actually put in action.
Like from a rights perspective, from a social rights perspective, I think that it's a necessity for government to provide a social network for its citizens. So from that underlying principle, yeah, I believe that universal health care reform is a necessity, but I believe in its current form and the current opposition in terms of bipartisanship and lack of solidarity between even citizens and the government, it'll never pass into effect. But I am for it, and I think it's a underrated social program that needs to be in place.
I am personally for universal health care because I know a lot of people out there that cannot afford to actually have health care and whatnot. My friend, for example, kind of struggles with his prescriptions every month. And I think universal health care would be a plus for the United States.